Alrighty, so I wanted to give you a recording of 3 different topics we did not get to cover in class yesterday. The first one that we're going to talk about is Kawasaki disease. Kawasaki disease is also known as monocutaneous lymph node syndrome. And it isn't a disease that is contagious to anyone else. There's really no known particular cause for it. The school of thought is that it is a defective, like an immune response, like a hyperimmune response to some kind of an infectious agent. So the cause could be viral or it could be bacterial, but in this instance, you're going to see a disease or a syndrome where you will have an acute systemic vasculitis. Typically this will occur in children under the age of 5 years, and it's a syndrome that just has to run its course. There's no one treatment that will fix it. One of the long-term concerns with Kawasaki disease is there is an increased risk of the formation of a coronary artery aneurysm. Basically, there's an increased risk of an aneurysm anywhere, but one of the biggest concerns is the potential of a coronary artery. So with Kawasaki, the signs and symptoms are very classic, and one in itself is not diagnostic, but when you start seeing them grouped together is how they'll come up with the diagnosis of Kawasaki disease. So you'll see in picture A the bright red sclera, bright red lips, even larger photo there in photo B, and the strawberry tongue. Those will present in the earlier part of the disease, along with the fever. And then you will see a rash that will appear, such as C and D, and it appears on the hands and the feet. Very classic signs. The palms of the hand become very red, and the feet will also become very red, almost like a scald. And then there will be a diffuse rash over the trunk and in the diaper area. Now, going back to the eyes, one thing that differentiates between pink eye and Kawasaki is you'll notice there's no drainage. There's no exudate that you would see in a conjunctivitis. So they'll present with a fever, and the fever will be at its highest in the acute stage. I want you to look at the bottom of this diagram. You'll see it spans over a 9-week period. Kawasaki's is divided into 3 stages: acute, subacute, and convalescent. So in the acute stage, you'll first see the fever, and then the lips and the conjunctiva, the eyes, will become very red, and you'll start seeing enlargement of the cervical lymph nodes, and you may see in some cases myocarditis, inflammation of the coronary muscles. In the event of myocarditis, this child would be admitted for monitoring. Without the myocarditis, they may be treated at home. As they merge into the subacute phase, this is one of the more concerning periods of this disease. You'll see that the fever will slowly start to come down, and they may go a day without a fever, and then it'll flare back up, and then they'll go another day without a fever as the disease runs its course. You'll see that joint pain, arthritis, peaks at the beginning of the subacute phase. So they may have some mild joint pain going into it, and then because it is a diffuse vasculitis, which irritates and can potentially injure the lining of the vascular system, there is an increased risk for aneurysms, especially around the heart, the coronary arteries. Something else that's very classic is those red palms and feet. That peaks towards the end of the acute and into the subacute. But what is a classic sign of Kawasaki's is the hands and feet will peel. That's what the desquamation means. You'll see literally all of the skin around the hands and feet will peel off. And then in the convalescent stage, you'll see nail changes, such as white spots within the nail when that vasculitis occurred. And then also because of that widespread vasculitis, you'll see that around weeks 2 to 3, there is the highest risk of a thrombocytosis. This is where, because of the vascular damage, there is a risk for the formation of clots and the breaking off of clots. So one of the treatments for this may be heparin, or because it is a long-term period from 2 to 7 weeks, they may start them on an oral medication such as Coumadin or Plavix to reduce the chance of thrombosis formation. So that's what I want to cover for Kawasaki's. You as the nurse, your nursing care is going to be about treating the symptoms, providing for comfort, ensuring that you're doing thorough pain assessments and cardiovascular assessments. They may be fine in the morning and then deteriorate throughout the day or start showing symptoms of myocarditis, or you may start seeing chest pain or pulsation, abdominal pulsation. So you want to do thorough cardiovascular assessments as well as skin assessments, and lots of reassurance to the family and the child. Just like we've talked about with other cases, long-term admission is very hard on the child. It's also very hard on the family. So just lending your ear and being very present for that hospitalization. Okay, that takes care of Kawasaki. I will do a separate recording where we will talk about sickle cell.